Hi, my name is Dr. Rob Grand. I'm a urologist here with Washington Regional Ozark Urology. I want to thank Washington Regional for sponsoring this presentation. Today I'll be talking about kidney stones, and as a patient, what should I know about stones? I have no financial interest to disclose. So this presentation is for anyone who's interested in learning more about kidney stones. Also, if you've had a kidney stone that you've passed in the past or are currently passing a stone, this presentation may be helpful for you to learn about the treatments of kidney stones and to learn about ways to prevent stones. I'll be talking about what is a kidney stone, symptoms of kidney stones, how are kidney stones diagnosed, how are they treated, and how can I prevent the formation of new stones. So, what is a kidney stone? Sometimes the perception of what we think is a stone isn't necessarily the reality. And so how can something so small cause us so much pain and discomfort? To first understand kidney stones, you've got to understand the urinary tract. So this picture here depicts the urinary tract. And so we'll start with the kidneys. You have two kidneys and they're located in your back. The function of kidneys is to filter blood. During the filtration process, wastes and toxins within the blood are filtered out into the urine. The urine then drains through two small tubes called the ureters and into the bladder. And when you void, the bladder contracts and you're able to empty your bladder. So kidney stones form through supersaturation of certain elements within the urine. What happens is you have high levels of these compounds and they precipitate out of the solution, crystallize, and form a stone. This cartoon here shows how that process works. Calcium and oxalate are two common compounds that you can find in urine that form stones. When calcium and oxalate bind together in low concentrations, it dissolves within the urine and is a liquid. However, when you have a high concentration of these compounds within the fluid, they precipitate out of the solution, crystallize, and form a kidney stone. Kidney stones are composed of different elements. Some of these are calcium oxalate, like we just talked about, calcium phosphate, uric acid, struvite, and cysteine, to name a few. Calcium oxalate is the most common composition of kidney stones, and it's found in about 80% of all stones. Each type of kidney stone has a characteristic appearance under a microscope, and that's how we can identify which stone is which. Kidney stones are very common. About 16% of men before the age of 70 will be diagnosed with a kidney stone. About 8% of women. There are many risk factors for kidney stones. Here I have listed several of the risk factors that are associated with stone formation. I think it's important to point out here in Arkansas, dehydration, really because of the heat and the humidity in the area. It's very important to stay hydrated in this area because this is one of the top risk factors for stone formation. Okay, so what are the symptoms of kidney stones? Kidney stone symptoms are due to obstruction of the urinary tract. When the stone drops down from the kidney and becomes lodged in the ureter, urine can no longer drain from the kidney down into the bladder. That's shown here. When you get this type of obstruction upstream from it, or within the kidney, you get dilation of the renal pelvis and the kidney and stretching. This is a term called hydronephrosis. When you have this acute stretch, this is what causes the pain. And so this is why you get pain from kidney stones. So pain is the most common symptom associated with kidney stones. The location of your pain is determined by the location of the obstruction. So obstruction higher up in the kidney typically causes pain in the back, while pain lower towards the bladder can cause symptoms down in the pelvis. Symptoms usually come in waves, and it's also important to note that chronic obstruction may not cause any pain. So just because you don't have pain doesn't necessarily mean you don't have a kidney stone. Other symptoms include blood in the urine, nausea and vomiting, and urinary tract symptoms. How are kidney stones diagnosed? Although kidney stone diagnosis is mostly based on the history and the physical exam, imaging is required to make the complete diagnosis of a kidney stone. A CT scan of the abdomen and pelvis without contrast is the gold standard diagnostic modality for the diagnosis of kidney stones. Other diagnostic tests that are important during the workup may be renal ultrasound or abdominal x-ray. A urinalysis and blood work may also be performed during your workup of kidney stones. How are kidney stones treated? Treatment of kidney stones is broken down into two main categories: passage of the stone or surgery. I'm going to discuss each group in further detail here in a second, but as you can see, there's several modalities for each treatment group. We'll start with passage. Passage of the stone is also called medical expulsive therapy. Medical expulsive therapy is when we give you medications, medications to help with pain, medications to help with nausea, and also medications to help with relaxation of the urinary tract. And we give you the opportunity of passing the stone on your own. The American Urologic Association, as a guideline, recommends that any patient with an uncomplicated stone less than 10 millimeters at least have the chance to try to pass the stone. Now, I understand sometimes, with life, there's reasons you can't try to pass the stone and surgery is recommended, but just to know it is possible to pass stones that are 10 millimeters or less. I have a study here that's commonly referred to in urology, and in this particular study, what the authors did is they looked at stone size and passage rate, and as you can see here, smaller stones have a high passage rate, while larger stones have a lower passage rate. But still, as you can see, even the large stones still pass up to a third of the time, so there is a chance. Now moving on to surgical treatment options. First, I'm going to talk about drainage of the kidney. Drainage of the kidney is a process of placing a tube to allow urine to drain from the obstructed kidney out of the body. This is performed for different reasons, such as fast relief of pain, drainage of infected material from the kidney, or dilation of the ureter for further procedures. This is usually done by one of two procedures. The first is something called a ureteral stent. A ureteral stent is a tube that goes from the kidney to the bladder, and it allows urine to basically take its normal course to the bladder and bypass the stone. Ureteral stents are associated with symptoms, and that's because the inside of the stent can rub on the inside of the bladder, and so it is very common if you have a stent to have symptoms like urinary urgency, urinary frequency, and some pain with urination. Here's a picture depicting a stent. The nephrostomy tube is another option for drainage of the kidney. A nephrostomy tube is a tube that goes through the back and sits within the renal pelvis to allow the urine to drain out of the kidney. Nephrostomy tubes are beneficial because you can place a larger size tube and get better drainage from the kidney. The downside is, of course, is that it drains into a bag and you as the patient would have to manage this at home. It's important to note that neither of these procedures remove the stone, and neither of these tubes are permanent. So if you have a stent or a nephrostomy tube placed because of a stone, it's very likely that you're going to have a second surgery or second procedure down the road in order to remove the stone and to remove the drainage tube. Also on this slide, I want to focus on drainage of infected material. And that leads me to the next slide, which is something called a septic stone. I want to point out that a septic stone is an infection associated with a kidney stone. This is considered to be a urologic emergency. Symptoms you may have with a septic stone are fevers, chills, and flank pain. And if you have this, it does require emergent to urgent drainage of the kidney to remove the infection. So here's a picture of that. As you can see, the stone is blocking the kidney, and if you get the bacteria, which are shown here in the green dots, it's unable to be drained. And so when you have a contained infection, these continue to replicate and ultimately can get into your bloodstream and make you very sick. So just something to know is that fever, chills, and flank pain is something to be worked up. urgently, and you should call your doctor or go to an emergency room if you're experiencing these symptoms. Going back to treatment options, next I want to talk about extracorporeal shockwave lithotripsy, or ESWAL. The ESWAL is a procedure where shockwaves or shockwave energy is generated from a machine and sent through your body and to converge on a single point, and that single point is the stone. We can do pinpoint targeting of this stone by using continuous X-ray within the operating room. By sending thousands of these shock waves through the body and to the stone, we're able to break the stone into dust, and then you as the patient are responsible for passing the stone later on. This is a very good treatment for small and medium-sized stones, and it also has the lowest complication rate. However, something to note is that it also has a lower stone-free rate because you as the patient are having to pass the stones after the surgery. The next treatment option is something called ureteroscopy. Ureteroscopy is the use of a very small camera that is maneuvered through the urinary tract to reach the stone. Once the stone is reached, different interventions can be done to break the stone up and remove it. This can be from lasering the stone into little pieces or taking a small basket that fits through the camera, grabbing the stone and pulling it out. Ureteroscopy is also effective for small and medium-sized stones. It has a very high stone-free rate, but stenting is common and complications are known to be slightly higher with ureteroscopy. The last treatment option I want to talk about is something called percutaneous nephrolithotomy, or PCNL. PCNL is a procedure where we go through the back to remove large amounts of kidney stone. During this procedure, a telescopic camera is advanced through a passageway from the skin of the back into the kidney, and then a small sort of drill-like instrument is advanced through the camera, and the stone's broken up into smaller pieces and removed. PCNL is effective for all stone sizes, and it has the highest stone-free rate, but it usually requires a hospital stay, it usually requires pre-placement of a nephrostomy tube, and it has a high complication rate. So this treatment is usually reserved for patients with very large kidney stones or patients with kidney stones that have failed other treatments. How do I prevent the formation of new kidney stones? The number one way to prevent kidney stones is to drink more water. The American Urologic Association recommends drinking enough water so you make a minimum of 2.5 liters of water daily. That's usually about 5 to 6 16-ounce bottles of water daily. The importance of drinking more water is you dilute the concentrations of certain compounds within your urine like calcium and oxalate, so these aren't able to precipitate out and form stones. There are also changes you can make in your diet to prevent stone formation. Maintaining a balanced level of calcium in your diet is beneficial. Limiting intake of oxalate-rich foods is also beneficial for stone prevention. Oxalate-rich foods includes chocolate, coffee, beets, and spinach. Increasing intake of fruits and vegetables can be helpful if these fruits and vegetables have potassium and citrate in them. Fruits that have potassium and citrate are lemons, limes, oranges, and bananas. Also, limiting intake of non-dairy animal protein, such as red meats, shellfish, and seafood, can also reduce stone formation in patients who form uric acid stones. If you are still forming stones despite dietary changes, it is recommended to have a formal stone workup. This workup usually involves 1 to 2 24-hour urine tests, which show what elements are in your urine, a stone analysis, which looks at the composition of the stones you formed, and blood work to look at your serum calcium levels. Just know that if you are a recurrent stone former, there are some medications that may be beneficial for you in the future. And that's all I have. Thank you for your time, and that's it.